This is a continuation of treating the cubital tunnel syndrome with this patient that he had it for about a year with numbness and weakness in his right hand, and with about a month to 6 weeks of treatment, the numbness has reduced in frequency and the strength is actually returning. His right hand is stronger again. I wanted to demonstrate the IASTM technique, instrument-assisted soft tissue mobilization, with a dulled edge metal steel tool and an ointment. In this case, we're using, you can use beeswax, or you can use shea butter like I'm using right now. So we don't irritate the skin. And basically, the ulnar nerve comes down under the bicep and over the tricep in here in the fascia. So what we do with this tool, we break up adhesions. It helps to reorient muscle fibers and soft tissue in the proper direction. Inflammation usually happens to create haphazard orientation of fibers crisscrossed and creates adhesions around nerves, as in this case, or ligaments or tendons. And every time you move it, it creates extra irritation. So that's all we're doing. Do it in different directions, back and forth. And you feel a little bristly stuff right there, Chris? Yeah. And then the nerve after exiting there. Chris's problem is also he's got very muscular arms, so he was doing a lot of construction repair projects and also works with computers and the mouse a lot, so that compounded the problem. So the nerve travels along here, and you just do sweeps to the right and to the left. You don't want to brush too hard over the nerve. Go. We usually do this laying down. You okay? Any numbers?
Yep.
And then we want to get in this big forearm muscles, because the ulnar nerve after here goes right between the big flexor muscles, and they're very prominent in Chris's case, so I just want to loosen those up here. Alright, we can pause that and then we'll show. Okay, and so we did IASTM soft tissue mobilization a minute ago, and right now we're going to demonstrate the second technique that was effective in managing Chris's cubital tunnel syndrome. It's called nerve flossing. The concept is, say from the ulnar nerve, it comes from the neck, obviously goes down to the extremity. What you do is you shorten one side of the nerve and you stretch the other, and then you do the opposite, back and forth. So you're sliding the nerve back and forth around the adhesion to loosen it up. So Chris is going to help us demonstrate that. You might grab the one with your fingers straight ahead. So look straight down. Yep, good. And then, yeah, let's bring it up. There we go. Stretching at the neck as he's flexing the wrist. And do the hand now. Good, all the way. Get that elbow extended. Good. And back. With the head and away. So we're stretching all the scaling muscles that the nerves traveling through. And go ahead, grab the fingers again. And extend the arm. Stretch it. Do that a few times. Get it flexed there. And do one more time. Good. Good. Now we usually do a few more reps when we demonstrate the other one. With, yeah. So bring them together. Good. That stretches the elbow. And then flex that wrist. Perfect. And one more time. Bring them together. So you'd have to discuss it with your individual provider about which stretches. The different nerves have different techniques, depending on the anatomy, obviously, but you have to discuss the techniques with your individual provider. Thank you.